guys, my name is Cassie. I'm a nurse practitioner here at Monarch Health and Wellness and Monarch Med Spa, and I'm going to be talking to you today about hair restoration. So all things hair. We brought on this Alma Ted device a little over 6 months ago. We've been having good results with it, and a lot of people are requesting more information. So I decided to make this video so that you can watch it at your own pace, and then, you know, if you want to schedule a consultation, you can. You can go in more depth during your consultation. So there's several different reasons or causes for hair thinning, hair shedding, and balding. And finding out the cause is probably one of the most important things, but the treatment for all of it is generally about the same. So one of the most common causes of hair loss, hair thinning, is genetics. You may have heard of male pattern baldness or female pattern baldness, androgenic alopecia. So that is genetics. There is, hormonal issues. So not only menopause, but having too much testosterone can cause it. Things like PCOS. A lot of women have PCOS that can cause increased hair growth in certain places, but also hair loss in the places we want to keep it. And there's, sensitivity to DHT, which is part of testosterone. There is also, like I said, menopause, just aging process, unfortunately. There is also stress, lifestyle factors. Some people, when they're going through a very stressful situation, whether it's emotional, physical, they're sick, COVID, they lose all their hair. A lot of times it will actually come out in clumps. And that can be really an emotional time for people when they're losing their hair. So emotional, stress-related things can cause hair loss. Medical conditions, like I said, COVID, certain medications can cause it. So those are some of the, hyperthyroid, hypothyroid. Also, we do a lot of weight loss here, right? So weight loss causes hair thinning and hair loss. It's not the medications you're on. That's not what's causing it. It's basically malnutrition. You're not getting the nutrition that you need to keep that hair, so it just starts falling out. So making sure you're getting enough protein in, making sure you're getting a variety of vitamins and nutrients through food, and making sure you're getting enough of that. So those are the causes of it, right? So what do we do about it? So the first thing people usually do is they change their diet. They increase their protein. They start taking collagen, mixes and shakes and supplements. They'll start taking hair vitamins, things like Nutrafol or hair vitamins. So those are probably usually the first go-to, the first step in some situations. Like I said, if it's a nutritional deficit, this is going to help. But you have to be consistent. No matter what treatment that you have to be consistent. If you don't do it, if you only do it when you remember or every other day, guess what? It's not going to work. And you need a minimum of 3 months to notice a difference. It takes 3 months to notice that your hair stops falling out. It takes 3 months to notice you're getting new growth out of those hair follicles. So give it 3 months of no matter what you do. So like I said, that's usually the first stop. If you've done that and you're not seeing results, or you have very severe hair loss, or you have genetic hair loss like androgenic alopecia or male pattern baldness, the vitamins aren't going to do a whole lot, okay? It's going to help, but it's not going to do a whole lot. You need the next step, which is prescription medications. So there are several prescription medications, and every single one of them have side effects. So they're not the best for everyone, okay? Medications, especially for women who have PCOS, spironolactone is probably the most common. Also, just a lot of hormonal issues, spironolactone for women especially. There is also finasteride, that is for men, male pattern baldness. There's a lot of side effects with that medication. And like I said, you got to take it every day. So those are the prescription medications. There's also oral minoxidil, but then there's also topical minoxidil. So you may have heard of Rogaine. So those are topical serums or foams that you can put on your scalp daily or a few times a week. Those do help, but once again, you have to be consistent. Personally, I actually bought it because I'm like, I'm going to do this. I did it twice and then I'm like, So you have to do it daily. Results vary. It can cause some scalp irritation, some redness. Some people will even get some like little welts and things. And when you first start, you can have increased shedding during the initiation phase. So be aware of that you put it on, you may have more shedding initially, but then once you start using it consistently, you will see that new growth come in. So there's that. And there are two usually strengths of Rogaine or topical minoxidil. One is for men, one says for women. Women, use the high strength. It is perfectly fine. On the box it will say, if you're a woman, do not use this. Use it, okay? The women's minoxidil, Rogaine, is not gonna do a whole lot. The next step for treatment is going to be more invasive procedures. So there is something called PRP. A lot of med spas do it, and hair centers. So PRP is where they take your blood, they spin it in a centrifuge, and then they take lots of needles, syringes, and they inject it all throughout your scalp wherever you need it. That can be painful. I actually had a patient say that she had it once and she will never go back because it was so painful. I had someone else say that they were doing it and it wasn't too bad, but she had blood running down her face. For that, you do need a minimum of 3 treatments a month apart, okay, minimum, to see results. And for that, generally the price for that, from what I've seen in the area, is anywhere from about $500 per treatment to about $1,000 per treatment. So if you need a minimum of 3 treatments, that's at least $1,500 to $3,000 just for that. There are results that widely vary with that because it all depends on the quality of your blood. As we get older, the quality of our blood isn't the best, so those growth factors aren't going to do a whole lot. So again, there is some discomfort. There's also hair transplant surgery. So that's kind of a last resort for a lot of people. They've already done all the things and it's just not working. So hair transplant. And then there is the Alma Ted. So the Alma Ted is non-invasive. It does not use needles. It does not hurt. There's 0 pain. If anything, you hear kind of like a humming or a buzzing sound during the treatment. We actually had one patient fall asleep during her treatment. So there's no downtime. The only thing that we ask is that you come in with clean hair with no product on it. And then after your treatment, don't do anything for about 24 hours with it. So you don't want to wash your hair, you don't want to go and perm your hair or dye it or put a bunch of stuff in it. Leave it alone for 24 hours. Let that stuff really soak in there and make it work. So how it works is it's ultrasound technology. So we have this wand here, gun, whatever you want to call it. So first, initially, we go over the scalp, the areas. It's sectioned off into 5 different areas depending on where the problem lies. We go over it for about 2 minutes with the low sound ultrasound. This it opens up the follicles. It opens up the hair follicles. Then we get a serum, and with lots of different growth factors, we put it all over the scalp in that section. And then we go over it. We crank up the intensity on this ultrasound, and then we just go over it again for about 3 minutes at a higher intensity. And that really drives the medication, those growth factors, into the follicles where it needs to go. So for men, it takes about 30 to 45 minutes. For women, if you have, longer hair, it's gonna take about an hour and 15 minutes because we have to section it off and things. Again, there's no downtime, nothing hurts. Those are the treatment options. We also carry now Nutrafol. We also carry another brand of vitamins called Kodiak hair vitamins. Both of them are great. What I really like is the DHT blocker with Nutrafol. A lot of women, if you have PCOS, if you have high testosterone, androgenic alopecia, male pattern baldness, female pattern baldness, if you are on pellets or hormone replacement with testosterone, this is what you need, okay? I'm telling you right now. This blocks the DHT. A lot of times our body becomes sensitive to DHT and it causes hair loss. DHT, this will block it. This is used in addition to regular vitamins, okay? So this is an extra vitamin. Everything in here has been scientifically studied to prove that it does block DHT. I'm gonna make another video after this about pricing because I'm cut off at 10 minutes.